Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about nerve blocks and nerve ablations and their role as a possible means of pain management with knee pain and arthritis. So today we're talking about genicular nerve blocks. You might hear this referred to as genicular neurotomy. Excuse me, I can't speak well. You might hear nerve ablation, which is a similar thing but a little bit different. We're going to talk about these and what their role is in terms of a pain management strategy with knee pain, knee arthritis. So a nerve block is what they're doing is basically you have an injection that is performed to temporarily block the nerve signals from a nerve that is coming from your knee. So in normal circumstances, there's nerves that are all kind of in and around your knee joint, and they send information up to your spinal cord, to your central nervous system, to your brain, and provides the information and the signal of pain. And if you are blocking this signal through a nerve block, then potentially that nerve block will block that signal and you'll experience pain relief. You'll experience less pain and swelling and discomfort in the knee. And so basically what's done is an anesthesia is put into the nerve, numbs the nerve, blocks that signal, blocks any pain signals that there might be. So what they do is they perform this as kind of a diagnostic test. So they'll block the nerve, and what you do is you see what your symptoms, what your pain is like over the next few hours, the rest of the day. Potentially, you might experience significant pain relief, and this might last immediately and last for a few hours. And if you do experience this pain relief, what that means is that you might be a good candidate for what's called a nerve ablation. And with a nerve ablation then, what they're going to do is they're going to basically deaden the nerve or burn the nerve. So they're going to use radio frequency waves in through your skin into your body. And those little radio frequency waves are basically going to ablate or burn the nerve and basically block that signal. So instead of blocking that signal with the anesthetic that lasts for a few hours, now the anesthetic, now because you burned the nerve, you ablated the nerve, basically cauterizing the nerve, that signal is now blocked for a more long-term duration. And so the idea is now that that pain signal can't come up, you'll experience some pain relief. Now this pain relief can last for a number of months, so anywhere from 6 months to 18 months, 2 years is what it's advertised as, and can be very beneficial. What can happen over time is the nerve is going to regenerate and the pain is going to return, the sensitivity is going to return, and either you'll have to have the procedure again or you'll have to have other pain management strategies, things performed. Now, in some cases, this can be a very beneficial treatment approach. It can provide some pain relief, help you to function, help you to do things. I don't really think of it as a long-term strategy. I think of it as a number of months, maybe a couple of years strategy to provide pain relief. I think of it as someone maybe who's trying to delay knee replacement surgery, or someone who has just so much pain and discomfort that doing something to alleviate that pain to an extent to then allow them to do other things such as physical activity and exercise, such as physical therapy, other pain management strategies, that might be effective as well. The thing to think about, as always, and something that I kind of reiterate a lot of times, is that there are so many factors and so many things that play a role into your pain and the pain that you're experiencing. So to think about, if we just block one nerve or one signal, that might not fully eliminate your pain and discomfort. It might block the information and signal from there, but your central nervous system and your brain and your spinal cord and these parts of your central nervous system, they've already learned about that pain. They've already developed this sensitivity, this central sensitization to the pain and discomfort in your knee. So even if that signal might be blocked, they might still experience that pain signal and that information in some way or another that is a little bit complex, and we won't dig into that too much. But the thing is, there's so many different factors. You think about someone who has phantom limb pain, so they have an amputation and they experience that pain in their leg or foot that is no longer there. So in the same idea, you might still experience pain and discomfort in that area of the knee, even though that nerve signal is not there. One, because the central nervous system has sensitivity. Also, there's other nerves that are in and around the knee that can provide that pain signal and can provide that information, and they might become more sensitive after that other nerve has been ablated, or a couple of nerves. So it's really kind of one part of a pain management strategy. I'm not saying it's a bad thing or a negative thing. I think it can provide quite a bit of pain relief for some individuals, and it can last for a pretty decent time, a number of months or 1 or 2 years even. But I think that to be really effective and to be really beneficial, you want to incorporate other strategies into it. So if that's that you're using it to provide pain relief as you prepare yourself for a knee replacement surgery, if you're using it to provide pain relief so that then you can participate in physical therapy, or you can participate in certain physical activities, aquatic therapy, whatever it may be, you still have to have that component of retraining your system, retraining your body to be able to do things and do activities without that pain and discomfort. So it provides that relief, but I think it's just one component of that. And by no means am I any expert in nerve ablations or nerve blocks, but that's kind of my general thought about them. They can be helpful, but they should only be one part of the puzzle. Similar to cortisone injections. They provide this temporary relief for some people. Some people, they don't work as effectively, but they should really be just a short-term tool that is one part of your pain management strategy and your approach to managing knee pain, knee arthritis, swelling, whatever it may be. Thank you very much for watching, everyone. This has been the Knee to Know Show. As always, please subscribe. I'd love to hear your questions, your feedback, your comments, so leave those as well. Have a great rest of your day.